Government Bills and Orders for second reading. Bill 9, Protecting Choice for Women Accessing Health Care. Debate adjourned.
Are there any members wishing to speak to the bill? The Honourable Minister of Health.
Thank you very much, Madam Speaker. I'm proud to rise today to close debate on second reading of Bill 9, the Protecting Choice for Women Accessing Healthcare Act. I'd like to begin by acknowledging that we are joined by a number of women's choice advocates seated in the gallery who have come to watch today's debate and see for themselves who is willing and who's not willing to stand up for Alberta women. On behalf of all members of the legislature, I want to thank these strong, passionate women for their tireless work advocating for women's rights to make their own choices and for access to health care free from harassment, intimidation, and violence. Every day when I come to this chamber, I walk down the 4th floor and look to the east and I say, written high in the sky, now that we are persons. And this is really about women being able to exercise their own bodily autonomy, but also I think this is about this chamber being here to serve all Albertans, including the Alberta women who fought for us to have a voice in this place. And this women's issue is an issue that matters. Of course, we are very willing to talk about other issues, including the work we're doing to ensure that we have our pipelines built to Tidewater, the work we're doing to diversify our economy, the action we're taking to support local communities. But this issue is important too. And by acting on this today, we say to the women who are here today and to other women that we hear you, we support you, and we know how important this bill is. We know how difficult it can be for Alberta women to access health care safely. And they know how difficult it's been for far too many care providers to safely provide that care without being harassed, being forced to go to court, or being judged and treated terribly for the work that they do for our community. So, Madam Speaker, it's unacceptable to me that these women have to face this across our province. And that's why our government is standing today with women. And more important, that's why we are taking action. Before I talk about how this bill would protect women accessing health care, I'd like to add some clarification to some points that were raised in second reading. I mentioned that the injunction doesn't apply to public property. Just to be clear, both the injunction and the access zone include pieces of public property as specified in the injunction. I gave an example of a woman who was not able to access the clinic via the sidewalk. With only the injunction in place, the woman was forced to walk on the road through a puddle to avoid protesters. This, Madam Speaker, is unacceptable. Women should be able to access health care free of harassment, and this is why we have brought forward this legislation. I mentioned that legislation will provide a greater space of protection than the injunctions. The access zones extend further than the current injunctions in some directions, and the legislation will provide greater protection to patients and service providers at these clinics. The injunctions will remain in place, but the legislation will add crucial protections to patients to ensure that they aren't bullied, photographed, or recordings being made without their consent. Additionally, the legislation prohibits any photographs and recordings from being distributed with the purpose of discouraging a person from accessing or providing abortions on social media. This is something that many women raised with me, that when they walk into their doctor's office and see somebody holding up a cell phone recording a video, they felt very unsafe. I'm really proud that our government is working to make them feel safe and supporting them in accessing the care that they choose. I want to be clear that the injunctions are an important tool, and they have had an important enforcement mechanism. They've been an important mechanism in the past. However, in practice, they haven't always had the desired outcome of protecting women that I imagine the courts intended. That's why we're adding another tool through this bubble zone legislation. Through legislation, information about penalties are laid out clearly, and they're more easily accessible to the public and to law enforcement. This information can be found online in the public domain rather than having to go into a clinic to get hard copies of the actual injunction. It allows for better communication with protesters of where they're allowed to protest and about what the consequences are and violations should they not follow them. It provides law enforcement with better clarity when enforcing the legislation. I mentioned that the injunctions have had to be repeatedly amended at the expense and time of the clinics. Both clinic injunctions were implemented in the early 1990s and amended again in the 2000s. When they brought this forward initially to the government of the day, they didn't want to have injunctions. They wanted to have laws similar to those that were put in place in British Columbia. And they were told at that time, no, it just wasn't something that the government was willing to focus on, that instead they'd have to go to court. And then they went to court again. And what were they told just a month ago? They should go to court again. Well, Madam Speaker, that is not fair. That is not justice. These women deserve to be treated fairly under the law, and that's why we brought this bill forward, to make a law to protect these women. So in turn, the clinics can focus on their expertise. They can provide their clients with the care that they are seeking. They don't have to spend their resources and their expert time going to court. Madam Speaker, before I move to close debate on this bill, I'd like to talk about some of the stories that I've heard from women. Sorry. When I was at the Kensington Clinic, they have a journal in one of the rooms. And they walked me through the entire journey for women who are there exercising their right to choose. They walked me through the counseling area where women are given their full range of options and are given the opportunity to exercise choices in that moment at a later time around other components that they have questions and concerns about. And then one of the last spaces they have before you go into the operating room, they have a really quiet space with a journal. And a lot of women take the time to pick up that journal and write a few sentences about their experience. So without going into specifics about who these women are, I want you to know that one of the women talked about being married, having 2 children, finding out she was pregnant for the 3rd time, and trying to be really happy, trying to be excited. And she said no matter how hard she tried, she just couldn't get there. She was feeling sick. She was exhausted. She and her husband hadn't planned on having a 3rd child, and she just felt like she couldn't catch her breath. And she said sitting in this clinic after having an opportunity to talk to the counselor was the first time she felt like she had some control back in her life. Another woman talked about being a new Canadian and how in the country that she used to live in, this wouldn't have even been an option for her to have a legal abortion. She would have had to consider breaking the law to exercise her own bodily autonomy, and how instead she was treated with respect and compassion by the people inside the building who were giving her the support she needed to make this choice in a way that was going to be safe, that was going to be supported, and that was going to honor who she was as a human being. And there were other stories too that talked about what the women experienced when they walked into the clinic. And it is very real for the women who are walking into these clinics and for the people who love them. When they have brought themselves to this point of deciding to see a doctor and seek medical support for the choice they've made, they talked about hearing the protesters outside yelling at them when they were in the waiting room. So I want to say, Madam Speaker, this bill is sorely needed by these women who've asked us to do this, who've asked governments repeatedly to do this, and the women of Alberta deserve no less protection, respect, or dignity than the women of British Columbia, or Newfoundland and Labrador, or Ontario, or Quebec. Alberta women deserve the same respect, dignity, and protection that women in other jurisdictions have. So again, Madam Speaker, before I close, I want to thank the members of this Assembly who have chosen to participate in this important debate. I want to thank the members on this side of the chamber and some members on the other side for standing with Alberta women. And to the members who chose not to speak, for these women, for the healthcare providers, I'd like to remind you that the protections that you have in this place to do your job every day, including a speaker and including a sergeant-at-arms. We're not even asking for there to be a sergeant-at-arms accompanying these staff members while they walk in to do their jobs. We are asking for them to have some safety, some protection, and some dignity. Here in the legislature, we're protected. So I find it pretty rich to see some members afraid to come into this chamber to debate this bill and protect women and frontline healthcare workers. I find it pretty offensive to hear some members saying these women and workers should go to court just to feel safe when they're doing their job or accessing healthcare. If 90% of success is about showing up, well, then I think Alberta women are going to have a grade to give to the official opposition. Because, Madam Speaker, Alberta women deserve 100% support in this legislature. They don't deserve to be ignored by their MLAs who hide when it's time to protect them. They don't deserve an opposition that courts the support of groups who would defund their health care and their rights. And they don't deserve to be called a distraction. They deserve respect, and that's what they are getting from this government. Madam Speaker, I've mentioned that I've heard from a lot of women about the difference that this will make in their lives. And that's who this bill is about. This isn't about the leader of the official opposition. This isn't about freedom of speech. This is about freedom from intimidation tactics that rely on shame, stigmatization, and prevent Alberta women from exercising choices about their health care. So while the members opposite sit with their Conservative leader or stand elsewhere with him, perhaps, women across this province have said enough is enough. So, Madam Speaker, enough is enough. Thank you.
Thank you, Honourable Member. The Honourable Deputy Premier and Minister of Health has now moved second reading of Bill 9, Protecting Choice for Women Accessing Healthcare Act. Does the Assembly agree with the motion for second reading? All those in favour, please say aye. Aye. Those opposed, please say no. No. The motion is carried and a division has been called. A division has been called on second reading of Bill 9 as proposed by the Honourable Deputy Premier and the Minister of Health. On the Bill 9 Protecting Choice for Women Accessing Healthcare Act. All those in the Assembly that agree, please stand.
The Honourable Mr. Feehan, the Honourable Mr. Carlier, the Honourable Ms. Sigurdsson, the Honourable Mr. Mason, the Honourable Minister Ceci, the Honourable Minister Hoffman, the Honourable Minister McQuaig-Boyd, the Honourable Mr. Sabir, the Honourable Minister Miranda, the Honourable Ms. Gray, Mr. Rosendahl, Mr. Shepherd, Ms. McKittrick, the Honourable Ms. Payne, Mr. Westhead, Member Cordes Vargas, the Honourable Mr. Schmidt, Ms. Goring, Ms. Miller, Mr. Paquette, Ms. Luff, Ms. Woolard, Mr. Kleinstuber, Member Turner, Mr. Dang, Mr. Nielsen, Mrs. Schreiner, Member Connolly, Member Loyola, Mr. Malkinson, Mr. Dack, Ms. Fitzpatrick, Member Carson, Ms. Chasm, Mr. Horn, Mr. Fraser, Member McPherson, Mr. Clark, Dr. Swan, Mr. Hinckley, Mr. Sucha, Dr. Starkey.
All those opposed, please stand.
Mr. Fildebrand.
Madam Speaker, total for the motion 42, total against 1.